So Chris, we appreciate you for looking into Dream Dental. Here's the thing is, as easy as it would be just to throw out some numbers, it really is difficult to say exact timeline. Of all the things that we do here, giving timelines is probably the most difficult because every patient is different. If you're a fast healer, it's a 4 to 6 month process. If you're a super healthy person, there are some patients that we actually go through the whole process in just under a week. And so it's kind of a difficult question to say how long will it take. That's why it really takes a consultation. Come in, see why you're here, what's the most important things to you. We make all of our patients do blood work. We make them go see their doctor, they get a medical release. At that point, we can kind of get some estimates of time frames, how we think you might heal. But from our perspective, our model has changed over time because when we first started, we were really just seeing patients here in Utah. And now it seems like 50-50 of the people we see are coming from out of state. And so that has forced us to switch our model. And so when we do have patients come in from out of town, we do spend days and half days trying to get as much done as possible. And so, something that might take, 10 appointments in a regular office, we try to condense that in half for patients coming out of state. I can tell you this much is that we are built more for out of state patients today than we were even 3 months ago. And we're always trying to make it as easy as possible. That said, there are always things that are really difficult to, there's things we run into. For example, sometimes we have a patient from out of state that has a device that becomes loose. That can happen, and that's one of the hard things is you have to jump on a plane and come to Utah, or find a dentist that's willing to tighten up the device. So there's some things that make it a little more difficult for out-of-staters, but I think we're the best at helping those that come out of state still. Most people out of state, they appreciate the fact that we work hard. We have everything right here in our office. We have our lab. This office is built only for this treatment, and our pricing, especially for those out of state, is very, very competitive. I think that for the value, we crush it. I could be a little biased, but